The Ossatron is a revolutionary device that utilizes extracorporeal shock waves in the treatment of orthopedic indications. A shock wave is the result of an intense change in pressure, such as lightning. When lightning occurs during a rainstorm, water molecules rapidly expand, transmitting an initial pressure wave, and then contract or implode, sending a secondary pressure wave. The powerful shock waves from these reactions were first harnessed for the treatment of kidney stones, and now the Ossatron utilizes those same principles for orthopedic indications. Here's how it works. Inside a water-filled housing, a generator initiates an electrical spark between the tips of an electrode at the point known as F1. That causes the water molecules to vaporize, creating shock waves. These shock waves are reflected off of the inside wall of a metal ellipsoid and focused at a fixed point in the target tissue, known as F2. The Ossatron emits shock waves, causing microtrauma to the area. This promotes neovascularization and stimulates healing in a unique process called orthotripsy. The Ossatron is the first extracorporeal shockwave system developed specifically for orthopedic applications and is indicated when a patient has failed to respond to 2 or more conservative treatment options and has had pain for at least 6 months. It is so effective that usually only 1 treatment is necessary to receive maximum benefit. For many patients, an active lifestyle demands effective treatment for chronic pain. This segment of the Ossatron Training CD will instruct you in the treatment protocol for plantar fasciitis. Preoperatively, instruct the patient to discontinue the use of any medication containing aspirin or NSAIDs and any prescribed blood thinners for 3 days prior to treatment. On the day of treatment, first palpate the foot and mark the area of maximum tenderness. Once the area is located, the patient can be anesthetized. Anesthesia is recommended due to the pain involved with the procedure. And because the Ossatron procedure is loud, protective earwear is suggested for both medical personnel and the patient. With the patient supine on a height-adjustable table, support the lower leg of the affected side on a cushion or sponge with the knee flexed comfortably. Apply coupling gel to the heel or treatment head to promote good contact for an effective treatment. The technician will then move the device into position, and you are ready to begin. It is imperative that the surface of the foot be firmly coupled to the treatment head to ensure effective transmission of the shock wave. Lack of contact of the treatment head to the patient will result in poor outcomes. Move the heel in a circular motion within the focal zone, or invert and evert the foot on the treatment head, always maintaining contact with the membrane. A total of 1,500 shocks at a maximum of 18 kilovolts at 4 Hertz is delivered for effective treatment of chronic heel pain syndrome. Treatment time is minimal. After treatment, the patient will need to wear soft-sole running-type shoes home. Since driving after anesthesia is not recommended, instruct the patient to arrange for transportation beforehand. After the anesthesia has worn off, patients may experience some discomfort in the treated heel, since the aim of the Ossatron is to elicit an inflammatory response. The pain may subside but then return and gradually improve over a 12-week period as the body progresses through the stages of healing. Pain is usually manageable with over-the-counter medications. Avoid prescription anti-inflammatories that will negatively impact treatment outcomes. During the initial 4-week period following the treatment, normal activity is permissible, but advise patients to avoid stressful activity involving the heel, including running, heavy housework, yard work, or any sports. Encourage patients to wear orthotics if prescribed, and avoid wearing flat shoes, including sandals, loafers, or slippers for the entire 12-week period. Patients should stretch several times daily and before any special activities or walking long distances. Consult the manual for specific stretch recommendations. The maximum healing effect of the procedure can be evaluated after 12 weeks post-treatment. The healing effect varies among patients, and improvement may continue after the initial evaluation period. In a single treatment, the Ossatron can deliver success rates equal to or greater than invasive surgery without the associated risks and complications. Clearly, the Ossatron is a significant surgical alternative in the treatment of chronic proximal plantar fasciitis.